Good afternoon, ladies and gentlemen, dear friends. We want to start the session punctually. There's still people coming in because, of course, the interest in what is happening with Mpox is very large. And we thought that it would be important that we take this issue up here at the World Health Summit. And we're very, very happy that we've had the support of the Africa CDC to put this session together. And so first of all, I'd very much like to welcome my co-chair, Dr. Raji Tajuddin, who is the Deputy Director General of the Africa Centers for Disease Control. So please welcome him. As you well know, his boss, Jean Casser, was with us last year, also with other members of the team, of course. But as it should be in situations like this, it's important to be on your continent and in the countries that are affected. So we're delighted that Taj could actually come and join us. We were worried until the very end. We also thought that it would be really important to have a basic brief from the World Health Organization. Obviously, this is a public health emergency of international concern, and we're delighted that Dr. Maria van Kerkhove has joined us. Most of you at least know her from online virtual briefings, a famous face of WHO. So thank you very much, Marie, for joining us. So we're going to have two rounds with different sets of people. In this session, we will also have Dr. Mandy Cohen from the US Centers for Disease Control and Prevention, looking particularly then at the support and the cooperation between CDCs around the world. And we'll have Cécile Bilot here also with this perspective of partnership and cooperation from the European Commission, the Directorate for International Partnerships. So in this first round, you're going to get a feel, what's going on, who's supporting whom. Then we will move into the next section, and I'll give you a briefing on that then. So without further ado, we've asked Marie to start, Maria, so that we all start from the same page, so to say. Maria, please.
Thank you very much. Just make sure this is on. Can you hear me?
It's coming.
Okay, great. Thank you very much. So if you could pull up my slides. Thank you very much for the organizers for Africa CDC for the World Health Summit to be able to present to you today. I do want to acknowledge Fiona Branca and Michelle Yao, who are sitting up in the front here, my colleagues working day to day on Mpox. I'm sure that some of my other colleagues are in the audience as well. I'm presenting on behalf of a large number of people at WHO at the 3 levels of the organization working on Mpox. So a bit of setting the scene. So on the 14th of August, this year, the WHO Director General, Dr. Tedros, declared a public health emergency of international concern for the upsurge of Mpox. This was a day after the Africa CDC declared Mpox a public health emergency of continental security. The reason that WHO declared a public health emergency of international concern was because in a number of countries across the continent of Africa, most notably the Democratic Republic of the Congo, were facing an upsurge of Mpox cases. And this had been happening over several weeks, several months. The other reason for this declaration was the circulation of a new clade, clade 1b. And what you can see there, it's a little bit tiny, but there are multiple outbreaks that are happening across the continent of Africa. What I want to highlight with this slide is the complexity of the situation, the dynamic nature of the situation, and the real critical importance of enhanced surveillance, field epidemiology, to understand where the virus is circulating, who is most at risk, because this drives our targeted interventions, and it's dynamic in nature. Just to show a couple of quick slides here, I won't go into detail. What we need to be able to do with the Democratic Republic of the Congo, with Rwanda, with Burundi, with Uganda, is have more detail on this actual circulation. This is a map as of the 6th of October, but it's driven by basic Epi 101. Really, how do we have the right diagnostics in the right places to know who is at risk, who is infected, so that the interventions can move around the country and be dynamic in nature. Our focus is largely on clade 1b circulation, where we are seeing human-to-human transmission in sexual networks with sexual transmission, but also entering into families. The close, physical, intimate contact is how this virus is transmitting between individuals. Clade 1a is also circulating in many other parts of the Democratic Republic of the Congo, where we're seeing large numbers of spillover events in some circulation between humans. What we want to be able to get to is looking at this over time, because again, it is dynamic, and this drives the interventions that all of us are working together on. So what are we doing together? WHO and many partners, I see many whom are sitting in this room and who are present at this conference, together developed a global strategic preparedness and response plan. This is a comprehensive response plan. This is not a vaccination plan. And I want to highlight this because there's a lot of attention, particularly on vaccines. But what we really need to show is the surveillance, the EPI, the risk communication, community engagement, the home care, the clinical care, the IPC, WASH, access to clean water, which is really critical in preventing onward spread. There is also a continental plan for the continent of Africa, jointly developed by WHO and Africa CDC, and I know you will hear more about this. We're very grateful for the partnership that we have with Africa CDC, and again, many of the partners, many of whom are represented in this room. Just to highlight the comprehensive nature of the plan, our goal is to stop the outbreaks, and we believe we can do so, not only in the DRC, but also in neighboring countries, where concerted action can really, if we can target this in the right way, cannot allow this virus to take hold, and we can reduce the potential for international spread. 2 more quick slides from me. I was asked to show what WHO does within this space, and WHO, as the Secretariat of 194 member states, we never do anything alone. We do things with our ministries of health and also across many different sectors, working on a One Health approach, but also with many partners around the world. Our job is to coordinate the support for the member states, with the member states in the driving seat, with their sovereignty. The development of the implementation of the global and the continental plan with international, national, regional partners, and local partners. I highlight some images here on just some of the actions that we are doing together with many of you. You can see some images there on our research and development agenda, highlighting what critical gaps we have in our understanding for Mpox. There's SAGE recommendations looking at how vaccines can be used in a targeted way. The use of vaccines as part of this response is for targeted risk groups. And again, that's driven by our understanding of the epidemiology. We work with many expert networks around the world to develop evidence-based guidance, advice, and tools. Again, the science drives our actions, and we're working with many partners on access and delivery of medical countermeasures. There's 2 images there that you can see. We're working very closely with CEPI, we're with Gavi, with UNICEF, with Africa CDC, to make sure that the vaccines that are coming through, either bilaterally to donate to countries or through the access and allocation mechanism, which we have operationalized with the IMCM-NET partnership. And that's important because that's driven by our member states. It's an ask from our member states to do this in lieu of the fact that they're still discussing the pandemic accord, and I'm very hopeful that that could be completed by the end of the year. My fingers are crossed. But we do face challenges, and we will probably hear about this from many of our panelists. Not just financial challenges, but we have field implementation challenges. The DRC is a huge country with, again, a dynamic nature. We need to target those interventions. We don't want to lose sight on Burundi, on Uganda, on Kenya, and we have 2 new countries reporting cases, Zambia and Zimbabwe. We've had international spread to Thailand, to Sweden, also to India with travel from UAE. So there's a lot that's happening out there, and a global focus on this is really critical. This is the 2nd public health emergency of international concern we've had for Mpox, and we believe that in the next several months, we really could end this with the right efforts, with using every single dollar that is raised. But I should say we've only had 26% of the funding for the regional plan realized. And so that's really critical, that we need that funding to be able to deliver. And then last slide, I was asked to mention some learnings from COVID. So, none of you will be surprised on this. Anticipating the risk and risk monitoring is critical. We know there are many known pathogens that are out there. The work that the world has done on COVID and for other outbreaks is that those response activities is pandemic preparedness for the future. This is an investment that we need to politically drive that will be important, outliving any election cycles, that is important for the future, and it has been important for Mpox. We know the importance of rapid and a comprehensive response. Again, it's not one intervention alone. Early detection, strong isolation with clinical care, home-based care, targeted risk communication, really, really critical for this response. Next, comprehensive prevention, response planning, and action with communities at the center. Outbreaks, you've heard many times, begin and end in communities. They also can be prevented by communities. And what we want to be in a better position of where we know this circulation is, with the right information, with the right materials, clean water, soap, with the ability of clean blankets, as well as strong information, therapeutics, and vaccines, we can really help prevent the spread from even further. Clear, consistent, regular communication. I'm very grateful for this panel that we have and the partnerships that we have across all of the organizations represented here. The stronger the voice we have together, the better we can be in making sure that we articulate this risk clearly, we articulate the response, the needs of the people we serve, and how each of us are contributing to that goal. And lastly, the importance of global collaboration, coordination, solidarity, equity, and inclusivity. This was certainly clear during COVID. It is absolutely clear now. Again, why the importance of the work of our member states and their discussions of the pandemic accord remains so critical. So I'll end with that. Thank you very much.
Thank you very much. Can I just ask, for matter of interest, and maybe also for our speakers, who in this room is directly involved with responding to the Mpox situation right now? So there's a number of people in the room who can then perhaps also contribute. Who was involved in dealing with COVID? There you go. So you can check if the lessons you learned are being applied here. So let's see. So Taj, please, do you want to speak from here, or would you like to maybe you go to the rostrum, then people see you better. So we'll hear what's the strategy from Africa CDC, where we're at, how Africa is coming together around Mpox, but also what is expected from the international partners. Please.
Thank you, Ilona. Good afternoon, colleagues, ladies and gentlemen. As we heard from Ilona, Dr. Jan Kaseya was actually supposed to be here, but again, people will begin to ask questions. If you have Marburg and Mpox going on in your continent at the same time, are you supposed to be traveling at that time? You know, so this explains why Dr. Jan Kaseya could not be here, and he has asked me to come and represent him. So I will be doing this on his behalf. As we heard from Maria, on the 13th of August, 2024, the Africa CDC declared the multi-country Mpox outbreak on the continent of Africa a public health emergency of continental security. A day after that, WHO declared the same outbreak public health emergency of continental concern. So this actually underscores the severity, you know, and the alarming nature of the Mpox outbreak. Shortly after that declaration, we developed jointly with WHO and other key partners, most of whom are in this room, what we call the Continental Mpox Preparedness and Response Plan. And this plan is underpinned by one continent, one team, one budget, one MIE framework. Again, under the co-leadership of WHO and Africa CDC. And this continental plan is underpinned by 10 strategic pillars. One is around coordination and leadership. Of course, the reason is obvious. We do not want unnecessary duplication of effort. We want to make sure that in terms of our resources, we make optimal utilization of resources that have been deployed to control the outbreak. Number two, risk communication and community engagement. This is also critical. we need to take the community along. And much more importantly, the communication needs to be measured. It needs to be targeted and need to be most appropriate. Number 3 is surveillance, because we need to know what is happening where as far as DR Congo and other neighboring countries are concerned. Case management, infection prevention and control, vaccination, research and innovation, logistics and financing, and continuity of essential healthcare services were other components or other pillars of our strategic plan. Let me also say that this plan wasn't just, a sort of top-bottom approach. This plan was informed by the national Mpox plan of the affected member state. So that plan actually enjoyed the buy-in of most of our member states. So where are we in terms of this Mpox outbreak on the continent of Africa? From the beginning of 2024, we have a total of 38,300 cases, of which over 7,000 were confirmed. Sadly, 979 people have succumbed to this illness in 17 AU member states. The Central African region accounts for 88% of the cases, and DR Congo remained the epicenter of this outbreak. It's also important to know that more than 60% of the cases are actually among children less than 15 years of age. So this is also quite concerning, for people who are at the front line. So as we speak today, 17 AU member state healthcare system is being challenged. Lives and livelihood are being affected. This Mpox outbreak also have some sort of psychosocial dimension. We also know that our member state healthcare system also struggling to maintain the day-to-day essential healthcare services. We saw with the Ebola outbreak in 2014 to 2016, whereby many more people died from those day-to-day illnesses, malaria, diarrhea, and so on and so forth, much more than the Ebola. So this time around, as part of the pillar of this response plan, we're making sure that there is need to continue the essential health services. Today, we know that the member states who are reporting active cases are DR Congo, Central African Republic, Cameroon, Nigeria, Burundi, Cote d'Ivoire, South Africa, Uganda, Congo, Zambia, and Zimbabwe. So the big question is, what are we doing as Africa CDC to support these member states that are affected and those who are actually at risk of being affected? So Africa CDC is a specialized technical institution that sits within an intergovernmental political organization. So we're leveraging that platform to bring on board political advocacy, as we also at the margin of the UN General Assembly, when our head of state and government convened a meeting, bringing together the partners to mobilize resources for the Mpox response. Africa CDC is also at the forefront of mobilization of financial support, for the response to this Mpox outbreak. And in terms of research, we continue to work with the different partners, to make sure that the unknown, as far as the Mpox outbreak is concerned, doing everything possible to make sure that at least we have some data and we have some evidence, to guide the current outbreak and the future outbreak. And in that space, we are working to make sure that the epidemiology of Mpox is better understood. We are looking at survey around the Mpox vaccination uptake, perception survey. We're also looking at the Mpox vaccination efficacy, looking at what is it like, in terms of the deployment of this Mpox vaccine. Does it actually have what it takes to bring this Mpox under control? We're also looking at the safety surveillance, of the Mpox, and of course, we are using the opportunity to evaluate different diagnostic tests. One other area that Africa CDC continue to provide support is around such capacity, because we know that workforce is a critical gap as far as most of our member states are concerned. And in this regard, we have deployed epidemiologists, we've deployed data scientists, we've deployed behavioral scientists to support our member states as they respond to this outbreak. Africa CDC has also put together eminent scientists across the continent called the Emergency Consultative Group to guide the way we respond to this outbreak with science and data. Colleagues, ladies and gentlemen, global solidarity for vaccine donation is also one area that Africa CDC is working with partners, Gavi, US CDC, and so on and so forth, to make sure that we coordinate that space. And in terms of quantification, we have tried to understand what sort of number is required in terms of the Mpox vaccine to bring this outbreak under control. And today, I can say that we have been able to mobilize 4.3 million doses out of the 10 million that is required to bring this outbreak under control. One key area of support for Africa CDC is around diagnostics. When this Mpox outbreak started and Africa CDC started deploying support, in DR Congo, for instance, less than 12% of the cases were actually diagnosed. Today, we've moved somewhere close to 50%. So we've made some progress, but we still have some gaps in that space to make sure that we actually understand and know exactly what we are dealing with. Capacity building is also one area where Africa CDC continue to provide support. So we're training the healthcare workers on the ground around diagnostics. We're training them around case management. We're training them around surveillance, and we're also providing necessary support in terms of port of entry, because we know that DR Congo is a country that is surrounded and bounded by 9 other member states. So port of entry remains a critical aspect of our support. So colleagues, ladies and gentlemen, the underpinning factor here for what we have been able to do today, for the success we have been able to record today, is around partnership, around coordination and collaboration. So let me use this opportunity to thank the 28 partners, whom we have been working together. We are leveraging their differential strength and their comparative advantages to drive the 10 critical pillars that underpin the continental response plan. So, colleagues, we need to respond to this emergency as promptly as possible. We need to exert our collective effort. We need to broaden our understanding of the disease. This is the only opportunity we have to make sure we get it right in terms of documenting the necessary science that is around this Mpox outbreak. And of course, we also need to begin to have a robust discussion around local manufacturing capacity for the medical countermeasures. We cannot continue to import these medical countermeasures from the global north. So again, the Mpox outbreak has reminded us of the need to build local manufacturing capacity around security commodities, talking of vaccines, diagnostics, therapeutics, and other important medical products that is required to bring this outbreak under control. So colleagues, ladies and gentlemen, I would like to stop here. I really thank you, and we really look forward to what is it that we can do together to strengthen the air security sovereignty of the continent of 55 member states, 1.4 billion people. Thank you.
Thank you very much, Taj, for that very precise overview. We were hoping that you would really get a feel for what is happening on the continent, who is involved, and the needs that are there. But also, as you highlighted towards the end, that in a way the global health agenda is changing. Maybe 10 years ago, we would still have spoken about, how to get more vaccines from the north to the south, etc. There was very little discussion about production sites and independence in the production of what is needed in terms of therapeutical methods, etc. So thank you for highlighting that, because that, of course, also relates to some of the really important political discussions that already Maria referred to in terms of the pandemic agreement. We've got a number of those partners that you mentioned here today, and I'd like to first call on the European Commission, on Cécile, to give a feel for what the European Commission is contributing and how you are partnering with the Africa CDC, please.
Thanks a lot. I think I will stay here. And thanks for this overview, both from colleagues from WHO and African CDC. And I mean, we are really pleased to see from the beginning the joint action plan being put into action, because here, as you said, cooperation and having a same roadmap together is key to move that. So very much welcome. And we're really happy as the Commission, but also as Team Europe, with our EU member states, of course, to be active in responding to this plan. Let me maybe give a bit of an overview what we have done so far, and as from a donor perspective also how we fit into that. Of course, we looked at the joint plan very carefully with the 10 different pillars that you explained, and we have different departments in the Commission, so we have different strengths and different programs that support all this. Especially, we have colleagues from the research side who have programs in 9 countries for Mpox, different research items, being from water surveillance to clinical trials and so on. And we have 9 projects now on the continent for about $12 million, which have been activated now, and we hope it will really help also the research agenda on that. We have also colleagues who have worked from the beginning when the WHO and African CDC announced the epidemic, to deliver some vaccines. So we were donating 200,000 doses to DRC, and now today in Team Europe, European Commission and EU member states, we are more than 500,000 doses that have been delivered to Africa CDC. So that's, of course, one part of our response to, but not only to vaccine, and I think you made a point that it's not only a vaccination plan, because diagnostic and testing sequencing is extremely important to know afterwards where you're going to vaccinate, of course, and to really understand the scope and where the problems are. And on this, we have a new program also from colleagues from DG ERA of 9.4 million euro to Africa CDC, supporting for the testing and sequencing. So that's one also part of our response. From our side on DG INPA, we are not humanitarian heads. We have another department, ECHO, who is contributing with humanitarian aid too, but we are more there to really strengthen the systems, the delivery, and the country to be there for the countries. And we have a number of programs which we have allocated or redirected a little bit, and now we are also managed to mobilize 20 million euro in addition. I think our president yesterday made a point in her video, which will go directly to DRC to work really on the ground with WHO, with UNICEF, and with all local partner and African country to really help with the hotspots, with the delivery, and with the system strengthening, which goes hand in hand, right, with diagnostic and vaccines. So that's what we have on our side. So overall, we have, I think, as a Commission, looking at really all the different pillars and where we can put our strengths from the different departments to really respond to the Mpox crisis. In total, we have about mobilized now with the 20 new million euro, about 40, I would say, from the Commission, plus we have also the Team Europe, because we know we have to work in a coordinated manner, and we have been really discussing a lot with our EU member states where it fits, who is doing what, and then where the needs will be from there. And so we are strong in coordinating with Team Europe and having really an overall response also to our contribution to African CDC and Mpox for this plan. So very important. Now maybe also to say a word, because we are major also contributor, us, European Commission, but also many of our EU member states to Global Health Initiative, Gavi, Pandemic Fund, and Global Fund, and which were all showing that they were very relevant, reacting also to contribute to this plan. Pandemic Fund with fast-tracking some of the actions really for lab surveillance and so on, which of course won't deliver tomorrow, but it is really the strengthening of the lab and surveillance system which will contribute to crises as they will come and emerge, unfortunately. So we think it was important to get that really speeded up. And we really welcome that it happened. And of course, Gavi contribution on the vaccine side, also Global Fund. So that's really where we think all the actors should be mobilized and should work together. And now maybe also the challenge on that is that you have a number of different actors. And I think working at international level, at the country level, and in terms of coordination, it is a challenge, right? And I think we have to deliver on this challenge and showing that now these vaccines that we have mobilized, we can deliver it to people on the ground, and we can really support the country. And here I would really plead for getting that sorted out and getting together a system that works for the colleagues, not to have a beauty contest and all wants to be in the front line, but really trying to get that done on the ground. And because I think our colleagues from Africa CDC and the continent needs it, our Commissioner, Jutta Urpilainen, is today in Addis meeting with Dr. Kaseya. So for us, it's very important to know that we are together supporting Africa CDC and making sure that it goes down also to the country level most needed.
Thank you very much. Thank you, Cecile. And I think here too, and also from the comments of Ursula von der Leyen yesterday, I think we already see the expression also of some learnings from the COVID pandemic and what went wrong. I don't think anybody wants to repeat the dreadful experiences from then, and we have to learn and see how we can move forward. Another important partner, of course, is the US CDC. Mandy, will you share with us how you're working with Africa CDC on this specific issue? You, of course, have a whole range of other cooperations, that's clear.
Sure. Well, good afternoon, everyone. Mandy Cohen, Director of the U.S. Centers for Disease Control and Prevention. Great to be here. And maybe I'll do a bit of what Cecile did and what we've done so far, but really more to look ahead to the next weeks and months. The United States, as our president announced at UNGA just a few weeks ago, committed $500 million to this effort. That's on top of the $2.6 billion that we already last year invested in Central and Eastern Africa in terms of helping for capacity building overall. And in addition to that, up to 1 million vaccines, 50,000, which are already on the ground and being put to use, which is wonderful. But I want to echo what Maria said about that this not being just about vaccine, and to make sure that we are doing the blocking and tackling of public health that we've all learned to do. And what we are particularly focused on is making sure is in 3 areas. First is making sure we really understand the epidemiology and the transmission dynamics of this new clade 1B in particular. And we're really focused on understanding the household transmission dynamics, what is truly happening with families, young children, is there any transmission going on at school? Again, just really understanding that. And that fits into the second area, which is understanding the overall health challenges. I think Mpox is one major health focus, but we've had teams, we have a country office in DRC, but we've been helping with response to cholera, to measles outbreaks and others, and understanding how we can be improving capacity overall, but also understanding how the interplay of these different diseases is playing out in different communities and how we can best support folks in the capacity building and as well as understanding the dynamics of the Mpox clade B in particular. And then the third area of focus is to make sure that we are, as Cecilia was saying, all moving in the same direction, that we are all coordinated, that we're sharing information, that we have the appropriate laboratory testing, the data infrastructure, and the response capabilities, and that we are doing that each and every day, being incredibly transparent with each other so we can be the most effective that we can. So a lot of investment here, both with our multilateral partners as well as our bilateral partners, both DRC, Rwanda, and others. We know that we have many teams deployed across Africa. I'm very proud also of the work that we're doing to help in Rwanda related to our Marburg, that Marburg outbreak that they are seeing there. And I think there are important lessons learned as we respond to that urgent crisis that can help us also as we respond to Mpox. A lot of overlap there. So look forward to the rest of the discussion. Thank you.
Thank you very much, Mandy. So we have with us also Joy Pumamfi from the Global Preparedness Monitoring Board. And of course, you will know that the board has been very concerned about this cycle of neglect and response, and also trying to give recommendations to governments and organizations on how to really be prepared and how to use that preparedness and the capacities built there when a response is necessary. So Joy, could you share some reflections based on the GPMB work? Do you think it's going better now with the Mpox than perhaps it would have 5 years ago?
Thank you so much, Ilona, and very privileged to be here. I would like to thank the Africa CDC, the WHO, the European Commission, and the CDC US for, just being partners in this process with the countries under the leadership of the countries. Yesterday, the GPMB released our report for this year, and we're focusing on risks. And what I would like to appreciate is that your strategic approach, right at the beginning, your first bullet is, assessing the risks. That is so important. But what we are concerned with is that the risks that we have traditionally been assessing have been limited to, technological, biomedical risks, and some of the social risks, but not all. And we thought that it would be useful for us to map out all the risks that we actually need to focus on addressing in preparation for the next pandemic. So we have mapped out the social risks, the technological risks, economic, environmental, political, and even highlighted which of those risks are most neglected at the moment. Like the global movement, like trust. We need to rebuild trust. There's a lot of distrust now following COVID-19. Misinformation, agricultural practices under the environmental risks. Now, what we are observing as a board with Mpox is that, yes, some lessons have been learned since COVID, but our response has still been slow. We actually did a light touch assessment of what is currently happening now with Mpox. Which of the risks are still continuing to drive the spread of the pandemic? Obviously, one of the risks continues to be the movement of populations and the political and social instability. Of course, inequities in terms of economic inequities. We've also seen that the social challenges have changed because of the nature of this outbreak. It is now sexually transmitted. We're having children being infected. So the social drivers have now changed because of the context within which you have to work with this. And we have seen a delay in the receipt of the medical countermeasures. We are very grateful, of course, that both Europe and the US did deliver medical countermeasures, but how long did it take for those medical countermeasures to come? In the meantime, it's spreading. And so we feel that the drivers are still there. There is an improvement, and I think there is an even increased improvement now with Mpox outbreak in Rwanda, because the private sector and international community responded much faster than they did for Mpox. So I would say, yes, we are learning our lessons, but we still do need to incorporate all the risks. So our advice as the GPMB is that for WHO, countries, and Africa CDC, if when you do a risk assessment, do a full mapping. I encourage the countries and the regions to do a full mapping of all the risks, so that the different sectors that are responsible for mitigating the risk support the health sector, because the health sector on its own cannot mitigate all the risks. Because the technological risks on misinformation, for example, the health sector cannot handle that. The agriculture, the environmental risk in terms of agriculture, for example, and food production, and the health department, the health ministry cannot handle that. So you do need all the sectors to be involved in the mitigation of the risks. So the protection element, which is our second recommendation, is that first do a full risk assessment. And we have developed a mechanism. We hope that countries will be able to adopt it. Then you do the protection part and try and engage all the stakeholders, because collaboration, connecting with one another in order to make sure that you have effective PPPs, but donor relations and partner country relations are reinforced and become much stronger so that we can rebuild the trust that we have lost. And then finally, making sure that we do this in a sustainable manner, building the institutions, the factories, the research, the partnerships between the North and the South. So we feel we are on the right track, but we still need a lot to do. But this is another learning experience for us, and we hope the global community will take advantage of this.
Thank you very much, Joy. And before we move on then to our second panel and some additional input, I'd actually like to ask Taj to maybe comment on what you've heard right now. Don't need to do anything, just talk.
No, thank you, Ilona. And I think my takeaway from what I've heard is that everybody is ready, to provide their own sort of support to bring their comparative advantage and their differential strength to the table. From the European Union, we've heard around making available those medical countermeasures, providing financial support, also providing political support. For WHO, it's been so good. So I think we continue to work together, with the regional office and the global office in Geneva, so I think it's a welcome development that at least for the Mpox, I think we've been able to get it right. So perhaps going forward, this, we have a template, for us to continue to collaborate better going forward. US CDC, they've always been there, for Africa CDC from day one, talking of surveillance, talking of lab, so I think we'll continue to consolidate our partnership, our collaboration, and our coordination. And I think for Joy, they've done very massive work. So it's now for us to be able to make use of the data that they have been able to come up with to inform policy and practice, going forward in terms of responding to Mpox and any other subsequent outbreak in the near future. Thank you, and over to you, Luna.
Thank you very much for those comments. So it seems we are making some steps to learn, and it's not just panic and neglect, but actually learning and building competence and taking things forward with the best of intentions. The way this event will continue, we are now going to have an input from the East African community. We'll have a short video, and we will exchange the panel because we will have some other partners. You, of course, will stay. And so thank you very much for your contributions, and the colleagues will be here. I'm sure a number of the people in the audience who are working on Mpox will be happy to touch base with you. Thank you very much for joining us. Thank you. So it's my pleasure now to welcome Mr. Andrea Aguer-Arik Malvet. He is, as I said, with the East African community, the infrastructure, production, social and political sectors, the Deputy Secretary General in Tanzania. And I might add, we have had long discussions also with the Minister of Health of the DRC, but just like with Jean Kisea, he does have some other things to do right now. So you will understand why that direct link is not possible. So could we see the video, please, dear team, at the back there?
Your Excellencies, the guests, the distinguished host of this session, chair and the speakers of the session, ladies and gentlemen, good afternoon from EAC region. On behalf of the Secretary General of East Africa Community, Her Excellency, Madame Veronica Duva, let me start by expressing our appreciation as EAC for inviting us to this distinguished panel discussion. I regret not being able to participate in person due to conflicting schedules in EAC. However, I would like to bring it to the attention of the session that this particular summit is timely. It is indeed timely because this is a session happening when EAC is facing the Mpox outbreak. An outbreak of Mpox has also been reported in the region. Mpox is reported in the Republic of Burundi, Democratic Republic of Congo, and a few cases have also been reported in the Republic of Kenya, Uganda, and Rwanda. This outbreak poses a threat to our health systems and affect our economies and livelihood more broadly. We appreciate the leadership of head of state and appreciate authorities in fighting this threat. Over several years, EAC has built preparedness and response capacities in collaboration with key technical and funding partners such as the government of Germany, the government of Sweden, the African Development Bank, the Global Fund, and the Bill and Melinda Gates Foundation, just to mention a few. In addition, EAC established a regional network of national reference laboratories and procured for the partner state mobile labs which serve to rapidly detect dangerous pathogens such as Ebola, Mpox, and Mpox. A regional rapid response team has been set up to ensure a timely, coordinated, and multidisciplinary response to outbreak. Through our close collaboration with the African CDC, the US CDC, WHO, and the German government and other partners, experts have been trained and a regional field stimulation exercise has been conducted, and the pool is now ready for joint deployment in the region. NWASH facilities has been set up at the key border points and congested areas in the region. Despite this promising effort, several challenges in the response to Mpox and other infectious diseases remain. These include insufficient vaccine supply and distribution for all population affected, and various vaccine, especially in the remote areas. Health facilities in the region lack the necessary human and financial resources to manage outbreaks effectively. Surveillance of different Mpox diseases and sharing of data across EAC partner states remains difficult. This also applies to information sharing and risk communication at community level. Messaging needs to be adapted to local context. To overcome these challenges and further enhance its preparedness and response capacities, EAC is committed to intensifying its existing cooperation while leveraging new initiatives supported by our global partners, such as the European Union, Gavi, or the Pandemic Fund, USAID, just to mention a few. As a body of African Union, EAC continues to play an active role in the response to Mpox and emerging infectious diseases at the regional level, aligning with the continental plans and partners. Allow me to wish you a fruitful deliberation as I look forward to future collaboration. Thank you so much.
Thank you. We obviously wanted to make the point that there are, as you know, in any continent as large as Africa, there are many actors. There are many actors at the regional level. There are many needs for coordination. And particularly, again, if I take up Joy's issue around preparedness and some of the things we heard from the Deputy Secretary General, that it's absolutely critical that the cooperation and the support is actually one of continuous support in order to raise the competence and the preparedness within the countries. Could we close that door back there, please? Thank you. So we have two more partners that we're going to ask to join us on the panel now. We have Dr. Jakob Kramer from CEPI, the Coalition for Epidemic Preparedness and Innovations, and we have Richard Mihigo from the Gavi that has already been mentioned several times. Richard is the Africa Director at Gavi, so welcome very much. So Jacob, CEPI and its role has already been mentioned. There's of course the general innovation role of CEPI, which is ongoing, the 100-day mission and all those things. But what specifically has been CEPI's role now in relation to Mpox, and how do you see it developing over the next couple of months as well?
Yeah, so the Coalition for Epidemic Preparedness Innovations, CEPI, had been created as a direct consequence out of a previous outbreak in West Africa, the Ebola outbreak, to make vaccines available to respond to outbreaks and to make sure that people in need of these vaccines have access to them. And so to make vaccines available means to advance vaccine development, through preclinical phases, clinical phases towards licensure, and then also to assure manufacturing of vaccines in sufficient quantities. Now, fortunately, we have licensed vaccines for the Mpox outbreak, but these vaccines are licensed outside the current outbreak. They're licensed in the European Union, in the UK, in Canada, in the US. Not yet WHO pre-qualified, now they are. And Congo went ahead to release an emergency authorization for this particular outbreak. But of course, there's still evidence gaps that remain. Most clinical research activities had taken place in support of these vaccine licensures over decades, actually, outside Africa, where this pathogen actually originates from. So what CEPI did, and taking the C in our name very seriously, coalition, was to speak with partners around us, to listen to WHO's SAGE, to listen to WHO, to listen to the African Centers of Disease Control, but in particular, to listen countries in the middle of this outbreak. What evidence would they still need in support of vaccine use? So evidence is not just essential in support of vaccine licensure to make licensure decisions, but also to support policymakers, NITECs, in support of vaccine use. And there is a series of evidence gaps. We, with partners in Congo, for example, support a trial to generate more data on immunogenicity and safety of the vaccine used in African children, and to immunobridge into the adult population where this vaccine has initially been licensed. With partners in Congo and Uganda, we support a clinical trial to learn more about post-exposure prophylaxis in household transmission settings. We are currently organizing, actually together with the Africa CDC in close collaboration, a program to monitor vaccine safety data while these vaccines are being rolled out. We have visited Rwanda just a few weeks ago to talk about, the 100-day mission, how to accelerate emergency responses. So we are also working closely together with the government in Rwanda, which, as had been said, is only, somewhat remotely involved with a few cases in the southwest, to monitor their vaccine rollout, vaccine provided by the African Centers of Disease Control. Lastly, maybe not as a direct contribution to this outbreak, CEPI is funding the licensure, actually, of an additional Mpox vaccine, which is the BioNTech mRNA vaccine candidate, an organization based here in Germany, of which, as you know, has a manufacturing facility in Rwanda, so not too far away from this outbreak. So these are some of the activities that we look into. But let me again say all of this is happening closely with partners, with principal investigators, with authorities and policymakers in these affected countries, but also in the region.
Thank you very much, Jacob, for that briefing and update. I might use that opportunity to actually ask you, Taj, how is this whole area of licensing and regulation, etc., progressing in Africa around an Africa Medicines Agency or similar initiatives? Could you give us a short brief on that?
No, thank you, Ilona. So the Africa Medicine Agency has always been an agenda of our head of state and government. We know that Rwanda is the host of the institution, and essentially is to strengthen regulatory science on the continent, support the national regulatory authority, and to also address the issue of fake and counterfeit drugs on the continent, and much more importantly, to build the necessary local manufacturing capacity on the continent. So that is progressing very well. And for CEPI, I think as my colleague from CEPI rightly mentioned, around the pillar of research, as far as the Mpox outbreak is concerned, we've been working closely with them, especially to deploy some new tools, the late stage clinical trials, So these are all areas we've been working with CEPI. So I think we continue to coordinate and collaborate until we bring this outbreak under control.
Thank you, Taj. So we can see, there is a significant institutional development also happening on the African continent that will allow, much more in the most positive sense of the word, self-sufficiency and competence in dealing with a whole range of health issues. And it's very promising that a whole number of partners are contributing exactly to that structural infrastructure strengthening, I should say, and competence building. And we've frequently also said in discussions, there is the whole issue around, the health workforce, obviously. And very frequently in those discussions, people speak of doctors and nurses, but they don't speak about the regulators that are needed. They don't speak about the epidemiologists even, or the data scientists. And so that is also one thing that we would urge you to do if you're involved in any way with these kinds of initiatives, to keep an eye on exactly those kind of competencies. And we found that, particularly also the data competence and the regulatory competence are really competencies to be taken forward. So, Richard, how's Gavi involved in this? Many people might not think at first instance Gavi has anything to do with Mpox. So, what is it?
I hope. Okay. No, thank you, Ilona. Maybe let me start by precising my exact title. I think I'm the Director of Programmatic and Strategic Engagement for the African Union and Africa CDC at Gavi. And by the way, we just came back last week. I was in Addis with some of the Gavi colleagues to work with Africa CDC on how we can further support them in this response of the monkeypox, but more broadly also how to engage our other partner in this response. So Gavi has been, since day one, actually, very active in supporting countries. As soon as the Africa CDC and WHO declared their public health emergency declaration, I think internally in Gavi, we also articulated some of our emergency mechanisms to make sure that we can respond adequately to this outbreak on the African continent. And we have been, and I was glad to hear our colleagues on the first panel, and we have been really working across all the different colleagues to make sure that we can take an end-to-end approach across the value chain for vaccines to make sure that we can respond adequately to this. So we have been really coordinating very well with our colleague from CEPI, WHO, UNICEF, to make sure that our response to this outbreak goes through that approach of end-to-end. So from potentially the R&D aspect that my colleague just described, the access and allocation mechanism, but also the delivery part of the vaccine. So you also mentioned at the beginning, did we learn about the COVID-19 outbreak? By the way, we were very happy because some of the action that were taken by Gavi and an important decision that our board took actually more recently as part of our learning process in the COVID-19 helped us actually to pivot quite quickly and in an agile manner to that. So just a few months ago in June, our board approved what we call our Day Zero financing facility through what we call the First Response Fund, which is a mechanism that helps us to act quite quickly during an outbreak. So we were able, in a matter of days actually, to do the first drawdown on that 500 million fund to be able to do the first drawdown of $50 million to make sure that we can respond quite very quickly to this outbreak. So this was to respond particularly under the access and allocation mechanism framework that vaccines can be made available to the countries as soon as possible. So we're able to place an order for the vaccines in a very record time, really taking the lesson that we went through during COVID. But also not only to have the vaccine through our APA process, but also delivery support. So in terms of access, again, we were working with the partners to make sure that we can also facilitate some of the donation, either through the Bavarian Nordic himself, but also through the US government, Canada, that are now looking at Gavi with the track records that we have to make sure that we can actually coordinate the allocation process to the countries. And on the delivery side, and I think this is where it was important, and we discussed that recently with the colleague at Africa CDC, once the declaration was made and countries started to develop their plan, we were able to, even before the First Response Fund was made available, to make some of the resources, to reprogram some of the resources that were already approved at country level. This is what we did for DRC, for instance, where we, in the couple days after their declaration, were able to reprogram $2.9 million to support the delivery aspect in DRC. And just last week, using the same approach, we're able also to approve 1.5 million for Rwanda to first accelerate their delivery process. So I think looking back, when we see what we went through during COVID and trying to anticipate some of the needs, unfortunately, that now we are seeing on the ground, I think we can say that we have been quite, and this has been a joint effort with most of our partners to anticipate some of these shortfalls that we went through during COVID and make sure that country can get access to some of these countermeasures, can receive the funding on a timely basis, and be able to act. And then finally, part of this response, what we did was also to, through our colleague from Africa CDC, we anticipated as well that because we had a joint agreement with Africa CDC to support them on their pandemic preparedness, prevention, and response. So some of the resources that were allocated to Africa CDC, we were able to discuss with them, repurpose those resources to support the the Mpox response. We were able to approve, in consultation with our colleague there, capacity so that Africa CDC can have enough capacity to respond to this. So Gavi has been at the center of this response. Of course, we say that we need a multi-dimensional response, which is true across all the countermeasures. But when it comes to at least the vaccine, we have made sure that we can take an end-to-end approach and be sure that we can support not only WHO, Africa CDC, but also the countries to respond more efficiently to this outbreak. Thank you.
Thank you very much, Richard. And I think all these inputs show, the multifaceted approach, the issues that have been tackled before a crisis and are now during a crisis, and the better the work has actually developed before, the more one can work together and the better one can coordinate, obviously. Joy, does this make you hopeful?
It does make me hopeful. And I really want to congratulate the partners who respond. But, it shows that we are running, but I think we need to run a little bit faster. There is still limited access to medical countermeasures. We still have shortages of tests, shortages of vaccines still. Thank you so much for responding so quickly, both of you, Sepi and Gavi, and the partners who contributed. But there's still a shortage, and this the Mpox that is now in the region has also mutated, as we know. It is also now a sexually transmitted infection. And you know what happens when you have a sexually transmitted infection in terms of social behavior. So that is going to pose a huge risk again to controlling this. So that again puts a lot of pressure on vaccines, because people won't want to be tested, but so it means you really need to vaccinate more. So so the challenge is in identifying the at-risk populations, because you can't vaccinate everybody, is going to be even more difficult. And then there's the economic and social challenge. People make a living by the wages in the informal work. And so when you have an outbreak like this, when people are not able to move as well, so it means there's a huge economic downturn, particularly for the rural communities. And if people are not eating well, the medicines don't work, particularly when you talk about children who are currently infected. So we have all these risk factors. So it means we do have to run faster. And that is the only thing that I would urge. Say, yes, we're making progress, but more is required.
Thank you. So Taj, that's for you to come in then. More is required, run faster, says Joy. So what are your 3 big next challenges, would you say?
Sorry. No, thank you. I think colleagues have really, spoken a lot about what next. What else can we do, to make sure that we bring this outbreak under control. So one is the access to these medical countermeasures. Today, in terms of diagnostics, we are still less than 50% of where we are supposed to be. So a lot of support is required in that space. Number 2, around the issue of vaccines and therapeutics, we still have a long way to go. Number 3, a lot still remain unknown around the Mpox, and a lot of research is ongoing in the space, including new therapeutics that we're working with colleagues from Panta, colleagues from CEPI, and so on and so forth. So I think we need to also deploy a lot of resources in that space. Last but not the least for me, I think, is around coordination, collaboration, communication, and cooperation. I think this is critical. Thank you.
Thank you. And of course, we still have Mandy and Cecile with us. So I'd like to ask you, having listened to the second part of the panel, and particularly these last 3 points from Taj, what you would like to add to the conversation and where you see your role, particularly in relation to those 3 points. Mandy, would you like to start perhaps? Just take the rostrum there, we're very flexible.
Sure, I think a good conversation. I think we should use this opportunity to make sure that we're building capacity for the long term. And I agree that in making sure that in the next number of months, in order to best understand the epidemiology, we need to have the laboratory capacity, we need the data infrastructure, and importantly, need folks on the ground who are doing the important work of communicating and working with communities. So from the US CDC perspective, that is what we are focused in wanting to support both bilaterally in DRC, in Rwanda, and Burundi, but also with our multilateral partners as well. But if we all focus on really understanding the transmission dynamics, getting the data right, the laboratory capacity, and making sure we have the ability to do the case management. And I think that is really strong. And then, of course, I think vaccine is an important element, but only one element. And I want to make sure that as we work hard on vaccine and that we aren't forgetting the other pieces of this that give us the opportunity not just to respond to Mpox, but for the other health challenges that we see in the area and that we know we need to be focused on, whether that's polio or cholera or measles or others. So again, those core infrastructure and how do we use this attention on Mpox, which is very important for our global health security, to also strengthen the core capacities for the long term. Thank you.
Thank you, Mandy. Cecile?
Thank you, and Mandy made it very easy for me because she said it a lot. All as a capacity building is key, and of course, coming from the INPA for us, this is what the core of our activity are to support capacity building in our partner country. And I think this capacity will really help also with the unknown around the Mpox, so exchanging between all of us, research-wise, but also epidemiology and so on. So I think this is very important. We stand ready to continue to cooperate very closely with our partner, being with Africa CDC, with the Republic of Congo, the Democratic Republic of Congo, and with other countries at local level. And again, I think maybe what we could take from this, because it's a bit of a test case after COVID, let's put it this way, is how we can coordinate it together in a leaner manner.
Thank you, Cecile. So we have opportunity for 2 or 3 questions from the floor. Would you start, please? Yes? No, you just go up here. We don't have a mic yet. We surprised them a bit, so here you are. Yeah.
Thank you very much. I'm Dr. Michel Yao, Director of Strategic Health Operations for WHO. I think the question is based on what we just heard is, are we ready for the next pandemic? And the answer is definitively no. And why? Like in DRC, we left behind, after the Ebola response, quite a huge amount of equipment, including Gen Expert machine and others. But what happened to them is that there is an issue, for example, of some basic infrastructure, like access to electricity, access to water, training people, keep them on site with the high turnover. So all this combined is that we have to redo it again. So if it was a major crisis, we would have faced the same things again. So how can we do things differently for next time? How can we, if you look at in curriculum in universities, are we sure that we have incorporated lessons learned from COVID so that we train medical doctors differently? We train lab experts differently. We train district people differently. We equip them for a longer term, building the system for a longer term, like making sure that in facilities we have isolation capacity, because we have the virus in this environment, including Ebola and others, and this can come back again. It starts by killing health workers because they don't even have water in health facilities and isolation one. So the process is how collectively we support them for a longer-term approach, a risk-based approach. And risk-based approach is not only outbreak, it's only what is affecting people. What are the major causes of morbidity, of mortality, and how can we collectively address them for a longer term? And using also some of the sustainable development means like solar panels to keep cold chains, to make sure that at least the facility will continue working when a disaster hits. So it's a long-term process that required collective effort to strengthen the weakest countries so that collectively we can be safe. Thank you.
Thank you very much. This gentleman first. No, the other gentleman. Yeah, no, here, the one that's standing. Yes, thank you.
My name is Christopher Chukwu. I'm from Nigeria, but I work with University of Oxford. So I noticed that this discussion is mostly around the region of East Africa. So I'm also more concerned on how we are responding in other African countries, especially Nigeria, with the being one of the biggest country in the world. So just to be sure we are being proactive and also responding to this outbreak. Thank you.
Thank you. The gentleman behind there. Yes.
Thank you. My name is Dayo Adetifa, and I'm from FIND, so I guess you can imagine already what my question would be. My question is how, there are lots of important things, obviously, for response, but I would like to ask how we can put the diagnostic challenge on the front burner and not bury it within the envelope of medical countermeasures, because it is not receiving the attention it requires, and a lot more work needs to be done in that space for Mpox and for sort of everything else in between. Bottom line is linked to what Michelle has said, is how do we make sure that diagnostics for common conditions and outbreak or epidemic prone conditions are made available under normal circumstances and not necessarily only as part of an outbreak response. If it's disease X, yes, we understand we will have to develop a new test, but this is not a new condition. Thank you.
Thank you, and I'm looking for a young woman's voice, maybe from Africa. Over here, okay. No, we said we'd give young people a voice here in the summit. Please go ahead.
Okay, so good afternoon, everyone. I'm Abiodun Egwenu from Nigeria, but currently on my PhD in charity in Berlin. My question is, I think, the One Health perspective, because I know that we have a lot of diseases that are zoonotic, and Mpox is one of them. But I remember when the COVID-19 pandemic hit, everybody knew it jumped, because people were saying that it jumped from animals to humans. But all our response was mainly in the health sector, and the veterinary sector was so minimal. So I just wanted to say, maybe we'll also look at this conversation. The One Health perspective is very important. Like in Nigeria, we are starting a research where we are looking at hotspots, animal health, and also environmental swabbing. And we found out that when we do surveillance in the environmental sector, if it's something in the environment, it's actually cheaper because you can also use it to predict or to say if this area is affected. So just to also ask questions around that space.
Thank you very much. We'll go back to our panelists now. Jacob, you sort of got nodding your head when you heard One Health. Will you say a word or two?
Yes, and let me try to maybe give a combined answer
yes,
to,
absolutely.
Maybe starting with Dayo, by apologizing that, CEPI looks primarily into vaccines, but we cannot even develop vaccines without appropriate and validated diagnostics. So I couldn't agree more with your point and the point that has been made numerous times here at this conference that diagnostics should also be very much in the focus of support. But let me try an answer to the other three colleagues. We need collaboration, communication, coordination, all of this, but I think we also need some sort of pragmatic approach, given the lack of infrastructure that we still face. So we in CEPI, we support vaccine development against a series of priority pathogens, including Lassa in West Africa, including Rift Valley fever, pretty much all over Sub-Saharan Africa, which has a very important public health aspect. We support chikungunya, we support filoviruses, Marburg, Ebola vaccine development, and so on. We wouldn't do a single trial or support, we don't do trials ourselves, we wouldn't support a single trial in the African continent without thinking this broader, without trying to make investment into the capacity, in the long-standing capacity, without working together with our partners. I'm really a big fan to this gentleman from WHO pointing at the infrastructure of the Africa CDC hubs and spokes model for clinical research. We know the clinical research sites that have been operating for decades. We know that there's many more that are not yet at that level. And maybe there's even some regions in the north of Congo, for example, where you don't have a clinical site. And we could pull together mobile elements, for example, for clinical research out of these existing sites. So we have to be somewhat pragmatic. But we will support, we have supported the largest EPI study ever done, I think, on Lassa in West Africa, supporting a lot of infrastructure. And now we're preparing for a phase 3 trial in that region. At the same time, we would like to leave infrastructure behind that is in place to react very quickly within 100 days, if I may say, to future outbreaks in that region. The same applies, to come back to Mpox, to the countries currently affected by Mpox. As I said, I just visited Rwanda 4 weeks ago. We built a lot of relationships which made us able to respond very quickly to the Marburg outbreak and make vaccine available in just 11 days. So it is about partnerships and it's about learnings. Thank you.
Richard?
Yeah, no, I fully agree with the comment made by my three colleagues, and maybe to elaborate more on that. Today we are 8 weeks since WHO declared the pandemic, the public health emergency of international concern. 8 weeks. On the ground, we were complaining before about the slowness of response, the countermeasure on the thing. And Joe, you raised that. The speed is lacking. Today, if we looked at the situation, we have close to 300,000 doses that are on the ground in DRC and in other countries. But the vaccination is lagging behind, at least if we speak about the vaccination drive. Only, I think, 2 countries have started to vaccinate. The gentleman there for Nigeria was asking and saying that we tend to focus on East Africa. That's not necessarily the case. I think the continental response has been continental-wise approach. But I think one thing that we have not learned very well from COVID, it's how we can actually act with speed, diligence, and agility, actually, when it comes to respond to the, this type of outbreak. And I think if we have to do something in the coming days, and particularly, Maria, you showed a very nice set of maps, how the Clade 1B is progressing in DRC. And if you looked at the global response plan, they are all focusing on, including the Continental Action Plan, on a very targeted vaccination approach, at least in this phase 1, to make sure that we can stop the transmission. But at the current pace, if we are not acting quite very quickly, I think we may see this outbreak spreading even further. So we are trying now to make sure that with, for instance, the doses that Gavi we have bought, the current available vaccine doses through donation can move quite very quickly in the countries, and then maybe we shift our attention to support the delivery of these countermeasures in countries to make sure that we can put an end quite very quickly at this phase 1. Otherwise, we are going to go into the same process issues that we went through COVID and then see a much more bigger spread. So my appeal today to our colleagues from Africa CDC, WHO, and all of us partners is actually to act quite very quickly, with speed, and support the countries, actually, and not spend all the time in planning and etc. So we need to act quickly so that at least we can say we've learned something from COVID. Thank you.
Thank you. So I'd like to spend the last minutes that we have in giving Maria 2 minutes. Are you planning or are you acting with speed?
Both.
Thank you very much. I mean, I think I'm agreeing with all the comments that are here. I do think in many respects we're better off, and in other respects we're, back where we started. The challenge with the building from where we started the last time is the sustainability. I mean, if I'm cynical, where was everybody in this room, 8 weeks prior to when both Africa CDC and WHO declared a public health emergency of international concern? Where in 2022, when we had a public health emergency, which ended in 2023, this cycle of panic and neglect is real, and we want to actively contribute to making sure we don't feed into this, but it's a political commitment, it's a financial commitment, it's a workforce commitment, it's addressing the risks. Part of the global strategy is addressing zoonotic spillover. That's one of the major objectives, because we do see that continuously happening with clade 1A. But it's challenging in the space that we're in. You look at the investment round that we had yesterday, which was incredible. Thank you very much for everybody contributing to that. But we are now competing with war, with displacement, with climate change, with economic crises, with gas price challenges. And the politicians who are in power right now have to make very difficult decisions. But the people that we serve are constantly fighting these challenges. They were fighting it in 2021, 2022, since 2017. Clade 1B has been circulating for a year. So I think I want to end on a positive note, that there is massive concerted effort. I think the partners are working very well together in a coordinated way. I think we understand each other's roles. I think we just have to continuously fight to make sure that we don't lose that attention and we don't forget the people that we serve, who don't care about who's in power, who don't care about all of these other things. They want to know, can I feed my child? Can I keep my child safe? Can I have a healthy life? Can my children go to school? And I think, Joy, what you were saying about addressing these risks, if we don't actually address these systemic risks that we face of clean water, and we will never really get ahead. So we are constantly running. We're not running from fire to fire. There's thousands of people that are working on prevention and preparedness. It doesn't receive the same attention as response. It's not as sexy as response, let's be clear. But there's a lot of us that are doing work in this space, and I urge all of you to really continue to remain focused on doing that and working in partnership to add value, where each of us can add value to these complex challenges. Thanks.
So we'll have a last comment from Taj. Let's hear.
No. I think for me, it's more of to really thank everybody. I think it's been a very highly interactive session. The good thing is that we all know what to do. We know the what, we know the how, we know the when, we know the where. And the most important thing is for us to really action the action item or the action point, So really, on that note, let's continue the good work that we're doing. Let's continue to apply the lessons, that we've learned. Going back to Michelle's comment, I think for me, it's go down to the need to strengthen our primary healthcare delivery system. If we are able to get it right at that level, I want to believe that every other thing should be able to fall in place. So we need to move away from a situation whereby the only indicator for us to know that there's an outbreak is when our healthcare workers begin to die. We need to move away from that. And I think one good way to ensure that we get it right at that level is to make sure that we have what Resolve to Save Life call the epidemic-ready primary healthcare delivery system. So on that note, thank you, colleagues, and have a great day.
So thank you very much to all of you. Thank you to everyone on the panel. Thank you for those wonderful closing words as well. And I hope this briefing and slight discussion session allowed you to take something back in relation to this outbreak, but also how we best prepare for what is to come. Thank you very much.
Thank you.